we have a lot to offer. I think we are very different than most programs, and our goal is to produce really strong orthopedic surgeons. And I think that has three facets. There is obviously an operative role, and we have a very innovative educational model that is called a preceptorship. So with the exception of trauma surgery and pediatric surgery, all of our rotations, our resident rotations, are 3-month blocks with a subspecialty preceptor. So that means that you spend 3 months with one individual, and that results in really accelerated graduated autonomy. You get early operative experience, and you get high case volumes from the very start. And that's a really strong point from an educational standpoint. But we also have a very strong commitment to didactics. We have scored in the 95th percentile, or over the 95th percentile for the last 15 years on the orthopedic in-training exam, something that we're pretty proud of. And that stems from a really strong commitment to education. We have protected block time for our residents from 6:30 in the morning to 8 a.m. every day. So I think from an educational standpoint, we do a great job. And I think our strongest point by far and away is our camaraderie. That was the thing that drew me to Geisinger. The relationships between the residents, and the relationships between, even the interpersonal relationships between the residents and the attending staff were just unlike anything I'd seen at any university program. And that's something we feel pretty strongly about maintaining today, is just a great working environment. I don't know if I've seen a better commitment from an institution to education. As I said, having protected time early in the morning is really unparalleled for the residency program. Our residents are able to present their research annually with a stipend. We have a great medical education stipend for them to travel and go to courses. Our residents are allowed to go to a required course every year in addition to what they might use their CME funds for. So I don't think you can find an area with better support from an educational standpoint. Being part of the Geisinger network has strong advantages. You really get a lot of cases and a lot of patients sort of drop into your lap. It really makes for a pretty good educational experience when you're sort of the only game in town. As a level 1 trauma center and a tertiary referral center, people really choose to go here because we provide the best services, and I think that makes for a great experience.